Western skunk cabbage medical information, also known as Lysichiton americanus, by Gary Ordog, MD. Skunk cabbage is a beautiful spring flower growing in the swamps in the west. It's an interesting plant because it is homeothermic and produces heat. It's a hermaphrodite, has both sexes in one. May actually be carnivorous, eating insects attracted by its horrific odor. Is capable of movement, retraction, and expansion in the spring, and it produces compounds like the thiols and indols that make it smell. Indigenous medicine use, but none of it has been scientifically proven, and it is toxic when raw. Consider rhubarb leaves that also contain oxalic acid, which burn the airway and throat like Dieffenbachia. Young leaves are edible if cooked. Also, the rhizome or the root is edible. Symptoms of eating raw skunk cabbage include burning in the mouth, hoarseness, sore throat, shortness of breath, and a cathartic action can cause severe gastrointestinal distress. A myriad of indigenous medical benefits have yet to be proven. To satisfy science would require randomized, double-blind, placebo-controlled studies. These may be a long time coming before any recommendations are made. Most animals avoid skunk cabbage, but interestingly, bears love it. After a long hibernation, the bears feast on skunk cabbage to relieve their constipation. And yes, this fellow, when he comes out of hibernation, is eating skunk cabbage. The skunk cabbage may actually save the bear's life as it relieves the bowel obstruction. This is oxalic acid. This is the toxin that is contained in ripe skunk cabbage, and usually from ingestion in human beings can cause the symptoms that were mentioned previously. So best to avoid eating